I'm Shobha Krishnan, founder and president of the Global Initiative Against HPV and Cervical Cancer. Thank you for giving me the opportunity to talk to you today. As you will see from Michelle's video and from the documentary film, the word cancer instills a fear in all of us. Why fear? Well, it's the fear of the unknown. We really still don't know what exactly causes cancer. We don't know how to screen for them in a safe and inexpensive method, and we certainly are not very good at curing advanced cancer. But imagine if I told you that here is a cancer for which we know the cause. We know the cause of what over 99% of this cancer is caused by. We have safe, simple, and inexpensive methods to screen for it. And when I say inexpensive, it's inexpensive even by the definition of the developing world, and for which we have very effective early treatment and late treatment. You're going to say, wow, that's great. But then I go on to tell you that this very cancer takes the life of a young woman between the ages of 30 and 60 every 2 minutes in this world. Yes, every 2 minutes in this world, thereby leaving behind young families with young children and devastating their lives. Well, colleagues, you know that this is not an imagination. This is real, and the cancer is cervical cancer. Cervical cancer is the only cancer for which we know what causes it. Over 99% is caused by the human papillomavirus, or HPV. We have safe, simple, and inexpensive methods to screen for it. For example, the Pap test and other newer screening methodologies. Did you know that the Pap test has reduced the incidence of cervical cancer by nearly 75% in the United States in the past 60 years? About 60 years ago, cervical cancer was the #1 cancer killer among women in this country. But today, it's not even in the top 10, thanks to the most effective screening test that we have in the history of medicine, which is the Pap test. And in addition, for cervical cancer, we also have very effective early treatment that we can actually administer in the fields in the developing world where the women work, such as cryotherapy. In addition, we have LEAP and other procedures to take care of this disease effectively. But in spite of it, we have 500,000 cases and 300,000 deaths annually in this world because of this cancer. And in the United States, we have 14,000 cases with over 4,000 deaths occurring on an annual basis, which really should not be the case because we have so many tools to prevent it at every single level. We have the HPV vaccines for primary prevention. We have Pap tests and other screening methods for secondary prevention. And we have good treatment for early cancer and late cancer for this disease. And this is where my organization, the Global Initiative Against HPV and Cervical Cancer, I think I have the pin here, comes into play. Our mission is to save lives from cervical cancer, one woman at a time, one day at a time, because we believe that no woman should die of this completely preventable disease. At this time, I would like to invite AMWA to take action and join us in the global fight against cervical cancer. How wonderful would it be if we as women worked together front and center to wage a war against this uniquely women's cause and win the war against cervical cancer, a war that can certainly be won. Thank you and have a great day.